introduce our team here. So one of the things about Rimrock Trails that's a little bit different than other facilities is that they actually are catered towards the adolescents and juveniles, which is not something that there's a lot of in Oregon, and they're actually not a lot in the United States. Oregon's about middle of the pack for the facilities they have. Rimrock Trails has been around since 1990, and in 1994 they were able to move their facility out of the hospital in Prineville and into its own facility where they hold their adolescents at. So some of the things I thought was kind of interesting was looking at the stats in Oregon for the adolescents and why Rimrock Trails is so important to our community and to our youth. In 2023, it was said that in Oregon that we held the ugly distinction of teenagers killed by overdoses. We had the fastest growing number of that in 2023. So facilities like Rimrock Trails obviously are important for our kids. The other reason that they're important is that they did a database search to try and see in the entire nation how many facilities treated youth, and in the entire nation there was 354 facilities that actually treated them. But when they started calling around and talking to them, they found out that most facilities either didn't have beds or they were so expensive. The average cost for a family to try and get an adolescent into a program that has an open bed that is not a nonprofit facility is about $28,000, which is required up front before they will take the adolescent in. And so the programs like Rimrock Trails are so important to our community and to our youth. And Darlene and Terry, you're going to tell us more about that.
Before Terry gets started, I just wanted, for those in the room who don't know what Rimrock Trails is and what we do. So Rimrock Trails, as Amber said, was started in 1990 as an adolescent residential treatment program for kiddos 12 through 17 years of age who struggle with co-occurring mental health and substance use disorder. We did that for a very long time. In 1994, we moved into a building off of 9th Street in Prineville that houses the dormitories, the kitchen, and some group counseling rooms. And then in 1998, we built a second building that has a gymnasium, school credit recovery program, and business offices. That's where our flagship office currently stands. However, sneaky news, spoiler alert, we just bought our own another facility in Prineville. So we will now have business offices maybe in another facility, which we're very excited about, meaning that we own all 4 of our campuses. So that's really helpful as a nonprofit, as you can imagine. So what we do, so let's jump forward 34 years. We also have outpatient services. We have counseling clinics for persons of all ages in Bend, Redmond, and Prineville. What's really exciting is we can now boast that we have over 70 employees, and last year we provided over 25,000 mental health services. So we do a lot here to support the Central Oregon community, and we do it as a nonprofit organization, which isn't easy. I can see Jane going, 25,000. So let me just play our video to just give you a kind of an overall.
Rimrock Trails provides professional counseling services for children, adolescents, adults, couples, and families who are struggling with various life challenges, including mental health and substance use problems. With locations in Bend, Redmond, and Prineville, Oregon, they have served over 10,000 Central Oregon individuals and families to date.
We know that there's a huge demand and a lack of available services for adults with mental health disorders in Central Oregon. We know that only 1 in 5 individuals who go to their primary care doctor and report struggling with mental health will actually be able to access the care that they need. It's very important to us that we create a system where access to care is quick, short wait times, and just to try and reduce any barriers that we can so that people can get into care and get the help that they need as possible.
It's not what's wrong with you, it's what happened to you. And this is a completely different way of viewing people, because if we can't function well, if we're not functioning well at work,
We're not going to be able to keep our job.
we're certainly not going to be fulfilled in whatever we're doing.
Since 1990, Rimrock Trails has specialized in the treatment of adolescent substance use disorders, operating one of the few adolescent residential treatment programs in the state. Over the last few years, Rimrock Trails has expanded to 3 locations, offering mental health services to persons of any age.
We've expanded our services in the last year. In our outpatient services, we now provide not only youth substance use treatment, but we provide services now for individuals through the lifespan. We work really hard to provide comprehensive treatment services so we can support the individual outside of the office. We have peer support specialists, which are individuals who have lived experience who can meet the client where they're at. Help them with a job interview, or help them go shopping, get the clothes that they need, or whatever it may be to help reduce the barriers so that they can have the most successful outcome.
Rimrock Trails maintains close relationships with other care providers to make obtaining services as easy as possible.
Maybe it's a client or a patient seeks support for anger issues or other mental health struggles from their primary care provider who's not in a position to do that. So they're able to refer them over to here, and we're able to give them that more long-term support after some other community agency makes initial contact with that client.
Because I've worked with adolescents in Redmond for the past 16 or 17 years, I've been very familiar about the work that Rimrock does to help adolescents. And as they expand and provide more services to more people in our community, I think it's important that people understand the value that they have in our community. The strength of community lies in its willingness to help those who are in most need. To be a place where we can help people understand the value of mental health, I think it's critically important for our success.
Our focus is really just on helping the individual or family live their best life, be their best selves. And that looks different for everybody. So we're not setting goals for people, but what do you want out of life? What do you want to change?
When you see someone you love struggle because they can't deal with, they can't cope with what's going on in the world or in their life because they've got a mental health issue that is undiagnosed or untreated, it's really painful because no matter how much you want to help, there's not much you can do. And so when they get the help they need, when they're finally diagnosed and they get the treatment that's necessary and their lives change and they become the beautiful, talented people that you know them to be, it's amazing. I would encourage people to think about what kind of community do you want. Where do you see us as a community in the future? Are we a place where we take care of one another? Because if we are, then we need to support mental health services. We need to support places like Rimrock because they're doing the work to help establish a mentally healthy community. When you can get someone the treatment and help they need, and it changes their lives, that's how you know you're doing the right thing.
Thank you guys. And our video concentrates a little bit more on our outpatient program. So I'm very excited to introduce our new clinical director of our adolescent residential treatment program, all the way from Texas, Terry.
This is my first time ever attending any Kiwanis event, so this is really exciting for me. So thank you so much for having me here to speak with you all. So as Michelle said, my name is Terry Bravo. I am the new clinical director for our residential treatment program. So just a little bit about my background. As Michelle said, I'm a transplant. I come from El Paso, Texas. I grew up on the border. For the last about 12 years, I was working in El Paso in different hospitals, clinics, as a licensed professional counselor. I am a licensed professional counselor supervisor, and so my specialty and my background is in trauma. That is something that I am very passionate about working with individuals who have experienced trauma, and we know how that can affect people in their lives. In El Paso, of course, we're right on the border, so there's that. We also have Fort Bliss, and so I had the opportunity to work with a lot of families who were helping their loved ones through post-traumatic stress and addiction as well. The two, we know trauma and addiction kind of go hand in hand a lot of the time. And so really, to be able to help people, it's important to address the whole person and the family that's involved in one as well. So that's a little bit about like where I started from. I originally came to Rimrock as a counselor. I was recruited because of my background and my specialty, my expertise. They had brought me in as a counselor, and I fell in love with the program. Like, I was just in awe of the good work that was being done. Being able to work with teenagers really it's special, because if we can intervene and we can help early on and we can give them the support and the tools and the resources, the hope is always that we can chart a course that might help them avoid some of the challenges that they might encounter without intervention, right? So I came as a counselor, and then the director position was open, and I jumped at the opportunity. I actually just relocated to Oregon, so I am that passionate about it that I was willing to bring my family here. So we're still getting to know the area. We just landed in July, but it's been amazing. And again, the organization is just a really awesome organization. So that's just a little bit about my background. Just to share a little bit more about Rimrock as a program and some of the things that really made me want to be here and make me really proud to be part of the organization. Again, it's working with adolescents, and there just isn't a lot of resources that are available for teenagers who are struggling with substance use and addiction, and also the mental health issues that go along with that. And so the fact that this is a program that really targets giving help and support to kids that are going through some of these struggles, it is really unique. Couple of things that make Rimrock, in my opinion, really stand out. Like, even with my background in other, organizations I've been part of, like some of the things that make Rimrock a little bit special. For one, many of the staff are in recovery themselves. They are individuals with lived experience, and so they're able to take everything they've learned and everything they've experienced, and they're able to impart that knowledge to the adolescents. And for the adolescents that are in our program to feel seen and heard and understood by somebody who's kind of been there, really forms unique bonds where we're able to reach them in ways that it might be challenging to if you hadn't walked in those shoes. So the fact that we have people who are mentors who can help them through that process is really, really special. We actually have, and because we've been around as long as we have staff members who were clients at one point. So we actually have staff that came to Rimrock Trails, got the help that they needed, were able to go on and develop in their education and career, and they've come back now as treatment aides to be able to extend the help that they got to the next generation, so to speak. The other thing that I think makes our program really special is we really do use like an individualized approach. So we meet every kid that comes through our door. We meet them where they're at. We use a evidence-based approach to helping guide them. It's called collaborative problem solving. Some of you, if you're in any education or mental health circles, you might be familiar with that. most people haven't heard of it, but collaborative problem solving is the idea that kids do well when they can. If we give them the tools, if we give them the knowledge, if we provide the education and help them learn how to problem solve, not just give them the solution, right? But actually like help them develop those problem solving skills and those critical thinking skills, it really sets them up for long-term success, because they can then take those skills and they can apply it in other areas. So we really individualize our approach to making sure that we're meeting the needs of each individual client. And that can look different from one person to the next. So that's just a couple of things that I feel like makes our program really unique. It's not a cookie cutter approach. It is really, it's a human approach. It's addressing the whole person, looking at all of the factors that have led to the development of either a mental health struggle or an addiction that they're struggling with, and really making sure that we're providing them the tools and the resources for recovery. Long-term sustainable recovery is the goal. So that's just a little bit about our program. Is there anything else? Great. Yeah. So I'm happy, like, to if you all have any questions or there's anything that you want to know, I'm more than happy to answer any questions that you might have. But again, I wanted to thank you all for giving me the opportunity to share about our program, because it really is, I know I'm biased, but it really is special. And the work that we do, especially being able to intervene when they're young enough to really make a long-term difference in their life, so super important. And that's what makes me really proud of the work that we do. Yes?
How many youngsters are you dealing with on a daily basis?
So, on a daily basis, we've been averaging about 10 to 12 at a time. We'd like to expand, so we're trying to grow the program. As of right now, we only have boys, but we would like to start adding girls and be able to offer our program to girls. So if we were able to grow the way I'm going to make sure that we do, then we would have up to 24. But since we've only had boys up to this point, it's been about 10 on average at a time.
I was curious about detox. I think the kids need detox, and is there a campaign that oversees that? What kind of drugs do you offer?
Yeah, absolutely. So we do have a medical director on staff. So they do get medical care. We do get kids that come in that are detoxing, and so our medical director will see them through that process to ensure that, again, while they're detoxing, they have the support that they need, both medically, and then we also have mental health professionals on staff as well, so they also provide that support. And then what was the other part of your question?
About what kind of drugs are prominent?
All of them. I would say honestly, the most common that we've been getting recently is marijuana. It is a challenge because with the legalization here, it's just more accessible. The vapes, super popular. Like that's kids everywhere. Coming from Texas, I can attest to the fact that if that was a problem in Texas as well. But we do also serve clients that are struggling with addiction to like methamphetamine, sometimes even opiates as well. And we have protocols in place to make sure that medically they're able to withdraw in a safe way from some of those more physically addictive drugs. Alcohol is another really common one. I think it's a generational, I'm just kind of speaking on the term, but I think it's a generational thing, because what I'm seeing is that alcohol used to be more the kind of drug of choice with teenagers. Nowadays, it's a lot of marijuana. They're actually, we do offer like help to those who are struggling with addiction to alcohol. But with the younger crowd, I see a lot more cannabis, if I'm being quite honest. I saw a couple of hands go up. I think you were first.
Do you provide these services to turn on different languages or just English?
No, so we do provide, primarily it's English and Spanish. So I have not yet encountered a situation where they were not an English or Spanish speaker. I happen to be fluently bilingual, and so that's been really helpful for the program as well. We are actively looking to have staff that are able to speak Spanish because that's the second most popular language that we have. But so that's so far what we provide. I haven't encountered yet another language beyond English or Spanish. Yes.
I was curious if you, in your experience, are seeing that grief plays a strong component in trauma and addiction with kids?
Absolutely. Grief is a trauma in and of itself, the loss, right? And adjusting to a significant loss in your life, that is traumatic. So that can be the loss of a parent or a family member, the loss of friends. One of the things, speaking on grief and trauma, we're still kind of figuring out what the long-term effects of COVID and the pandemic and all of the grief and loss that happened and the isolation that we experienced during that time. We still, like as mental health professionals, we don't know the long-term ramifications, but we know that there are long-term ramifications. So that's also like speaking on grief. We see a lot of that, for sure. Yes?
I know there's been an influx of a lot of illegally grown marijuana, which has harmful chemicals in it. Is that what you're seeing in the addictive section?
I couldn't speak to that, to be quite honest with you, just because when we're working with these teenagers, typically the conversations that we're having are more about kind of what led to using that substance and then what kept it going. As far as the source, we talk about that a little bit, but I have not heard that specifically, so I couldn't entirely speak to that. Yes?
What is your age group?
12 to 17.
And
if they turn 18, we don't toss them on the street, please know that. I just have to be really clear about that. It's 12 to 17, but if they turn 18 while they're in our program, we will see out their treatment and ensure that they have follow-up care when they leave.
what is your max capacity and what is the overall capacity for the state?
For the state, I couldn't speak to that. Right now, our max capacity is 12 because we're only accepting boys at this time. Again, my hope is that once we are able to open up to girls, it would be 24, 12 of each.
Guys, I'm so sorry we're out of time. It was such a jam-packed presentation. But before we go, Darlene is going to invite you.
Yes.
I'm going to turn it over to Darlene. Thank you all for having me.
A pared-down presentation here. We have a very special event coming up on October 24th at Posada Ranch. It will be our third annual A Night to Remember, and the general theme this year is bow ties and boots. Very appropriate location at Posada. You can bring out the elegance of country wear, and we will have live band, grits and gravy. We'll have line dancing instruction and photo opportunities with the photo booth, lots of food, lots of live and silent auctions, special raffle ticket sales, and wonderful things that you can win and outbid others. So if I had a bit more time, I would say we need some volunteers for a few things. It's wonderful being in a room filled with people who are so enthusiastic about the events within the community, supporting those in community, and doing that with your own time and talent. We appreciate So I will come back and expound upon our volunteer program at another time. Thank you.
Terry and Darlene, would you like to come up, and Brian too? Brian has made these Rimrock Trails pens, and as a token of our thank you for coming and taking some time today, I feel like you should be in like,
Yes, I made each one of these individually. Thank you guys very much. I really appreciate it. And I used to work at Rimrock Trails too, so I was. 2000.
Sounds like another story. All right, maybe you can.
Oh.
thank you all.
Also, you can buy tickets for the event.
Yes.
Rimrocktrails.org.
Yes. Oh, Barb just reminded me, Rimrock Trails also has our coffee platter at our Redmond Clinic on Friday. So if you are doing anything and want to support the chamber at Rimrock Trails,